Hello everyone and welcome back to WUT News, your trusted source for insightful, educational content that matters to your health, your life, and our world. Today, we're going to talk about one of the most important health topics in modern history, HIV and AIDS. If you want to stay informed with trustworthy, science-based videos like this one, make sure you hit that subscribe button and turn on notifications so you never miss an important update. HIV and AIDS have shaped entire generations, transformed public health, and impacted millions of lives. Whether you've heard about HIV in school, through the news, or not at all, this video will give you a complete understanding from what HIV actually is to how it spreads, how it's treated, and how the world is fighting back. In this video, we are going to cover what HIV and AIDS are and how they differ, the history of HIV/AIDS and how it was discovered, how HIV is transmitted, how HIV affects the body, global statistics and where HIV is most widespread, prevention methods that actually work, testing and treatment options, common myths and facts, latest scientific advances, how you can protect yourself and others today. By the end of this video, you'll understand not just the science of HIV/AIDS, but also the human story behind it, the suffering, the resilience, and the hope. So whether you're here to learn for school, to protect yourself or someone you love, or just because you want to be better informed, you're in the right place. And remember, knowledge saves lives. Now let's dive in. What is HIV? What is AIDS? Approximately 500 words. HIV stands for Human Immunodeficiency Virus. It is a virus that attacks the body's immune system, specifically a type of white blood cell called CD4 cells. These cells are essential for fighting infections. When HIV enters the body, it targets and destroys these immune warriors, weakening the immune system over time. If HIV is not treated, it gradually reduces the number of CD4 cells and makes it harder for the body to fight infections and diseases. AIDS stands for Acquired Immunodeficiency Syndrome, and it is not a separate virus. Instead, AIDS is the advanced stage of HIV infection. When someone's immune system becomes severely damaged because of HIV, typically when their CD4 cell count drops below a certain level, or they develop certain opportunistic infections, they are said to have AIDS. Importantly, HIV is the virus. AIDS is the condition or syndrome that can develop when HIV goes untreated. With modern medicine, many people living with HIV never develop AIDS. They can lead long, healthy lives with proper treatment. HIV cannot survive outside the human body for long, and it cannot be transmitted by casual contact, like hugging, shaking hands, sharing utensils, or using the same toilet. Now that we know what HIV and AIDS are, let's explore how the virus was discovered. The history of HIV/AIDS, approximately 700 words. The story of HIV/AIDS begins long before most people had ever heard the term AIDS. Retrospective studies of preserved blood samples show that HIV was present in humans as early as the late 1950s in Africa. It is widely believed that HIV originated from a similar virus found in chimpanzees, a virus called SIV, Simian Immunodeficiency Virus. Scientists think SIV crossed over into humans when people hunted and consumed bushmeat, an example of a zoonotic transmission, where a virus jumps from animals to humans. But the virus remained largely unnoticed for decades. It wasn't until the early 1980s, when clusters of unusual illnesses appeared among gay men in the United States, that the medical community began to recognize a new disease. In 1981, the first official reports of what would later be known as AIDS were published by the U.S. Centers for Disease Control, CDC. Doctors were seeing rare infections like pneumocystis pneumonia and unusual cancers like Kaposi's sarcoma in previously healthy young men. Something was seriously wrong. These were diseases usually seen only in people with severely weakened immune systems. At first, no one knew the cause. There was fear, confusion, and stigma. Some early theories were misguided and harmful, including ideas that AIDS was a gay disease, which we now know is not true. In 1983 and 1984, researchers in the United States and France independently identified the virus now called HIV. In 1985, the first blood test for HIV was developed, allowing scientists and public health officials to detect the virus in donated blood and diagnose people. Over the following years, HIV spread rapidly, especially in sub-Saharan Africa, where large populations, limited access to health care, and socioeconomic factors amplified the epidemic. By the mid-1990s, HIV/AIDS had become a global crisis. Tens of millions of people were infected. Many millions had died. Entire communities were devastated. Lifespans in some countries were dramatically shortened. At the time, treatment options were extremely limited. Then came a turning point. Modern treatment, antiretroviral therapy, approximately 500 words. In 1996, scientists developed a powerful combination of drugs known as antiretroviral therapy, often shortened to ART. ART works by blocking HIV at various stages of its life cycle. Instead of attacking the virus directly, these medications prevent it from replicating, meaning the amount of virus in the body drops to very low levels. This achieves something remarkable. The immune system can recover. People living with HIV live longer, healthier lives. The risk of transmitting the virus to others is greatly reduced. In fact, today, the science is clear. If a person living with HIV takes ART consistently and maintains an undetectable viral load, they cannot transmit HIV sexually. This is known as U equals U. Undetectable equals untransmittable. ART has transformed HIV from a death sentence into a manageable chronic condition for millions of people around the world. However, access to ART is still unequal. In wealthier countries, most people living with HIV have access to treatment. In poorer regions, especially parts of Africa and Asia, access is improving but still lags behind. How HIV is transmitted, approximately 600 words. HIV is transmitted from an infected person to another person in specific ways, and it is not transmitted by casual contact. These are the main routes. 1. Blood. Sharing needles, syringes, or other equipment for injecting drugs. Receiving contaminated blood products or transfusions, rare in countries with rigorous blood screening. Sexual contact. The most common mode worldwide, unprotected vaginal or anal intercourse with an HIV-positive person. Oral sex has a lower risk, but transmission can still occur if there are cuts or sores. HIV enters the bloodstream through tiny tears in mucous membranes or skin. This is why unprotected sex with a partner of unknown status carries risk. Mother-to-child transmission. HIV can pass from a mother to her baby, before birth, during pregnancy, during childbirth, or through breastfeeding. But with proper treatment during pregnancy, childbirth, and breastfeeding, the chance of passing HIV to a baby is extremely low. Occupational exposure. Healthcare workers and others exposed to blood through injuries, for example needle stick accidents, are at a tiny risk, but post-exposure prophylaxis, or PEP, can prevent infection if started quickly. Not transmitted by shaking hands, hugging, sharing meals, kissing, unless blood is involved, swimming pools, or toilets. Understanding how HIV spreads is essential because fear and misinformation can make stigma worse. Global impact and statistics, approximately 500 words. HIV/AIDS is a global pandemic, and while progress has been remarkable, the virus has taken a huge toll. According to the latest global data, more than 38 million people worldwide are living with HIV. Since the beginning of the epidemic, more than 80 million people have been infected. More than 36 million people have died from AIDS-related illnesses. The epidemic has not affected all regions equally. Sub-Saharan Africa remains the hardest hit, with the largest number of people living with HIV. Other regions with high prevalence include parts of the Caribbean, Eastern Europe, Central Asia, and Southeast Asia. Some countries have made astonishing progress in reducing new infections and expanding access to treatment, while others still struggle due to lack of resources, social stigma, and political challenges. HIV